Hey, it's Dr. Brian McKay, Core Health and Darien. First of all, happy July 4th. It's pretty early in the morning. I wanted to discuss tennis elbow since a lot of people could be playing tennis today. Might as well get the jump on it. All right, tennis elbow, lateral epicondylitis. It's a great Scrabble word if you ever need one. By the way, medial epicondylitis is the term for golfer's elbow. So basically, if you have elbow pain, everybody's going to call it tennis elbow. You'd be surprised to learn it's not just tennis players. Carpenters get it. People do repetitive motions with their using their arms will develop it. So basically, it's a repetitive sprain strain on the elbow. The elbow is a hinge type, a ginglymus type of a joint, um, very much like the knee. Very powerful joint, and you have to think too is when you're whacking that ball, those forces get put through into your elbow. Now, the first thing is elbow braces for tennis elbow. They work pretty well because they take the tension out past the elbow joint. If you think about it, you can put your hand right around it. You really can't put your hand around your shoulder joints. It's just not as big, and I guess it's not meant to take the brunt of what you're doing when you're whacking that ball. So here's what it consists of. The elbow joint. The humerus is the bone that's your upper arm. Then you have the radius and the ulna. Um, Radius is a real cool bone because it allows you to turn your hand in and out. Very, very cool bone. Um, the ulna, it's just kind of there, but together it makes for a lot of motion. It's kind of similar if you think about how in your lower part of your leg you have the tibia and the fibula and the femur on the top. And so it's similar in terms of relationship because fibula doesn't really do much. It's kind of there. Ulna doesn't do much, but it's kind of there. Radius does much of the work, as does the tibia. So what will happen is the ligaments can get wound up a little bit too tight. Um, they call them the elbow is supported and strengthened on each side by what we call these strong collateral ligaments. Um, and very, very, very thick, and they anchor a ligament, like example, the ulnar collateral ligament. It starts in the medial epicondyle, the humerus, then shoots over into the radius. Um, and what happens is that the ligaments attach bone to bone, and sometimes they fray at the insertion point to the bone. So a really bad tennis elbow can have a fracture. It's called an avulsion fracture. Not very common, but you can if you bang it up enough. And typically, what the real gung ho tennis player is going to do is they're going to pop the Advil at ice and take it easy a day between matches, or like a day like Fourth of July, if there's a bunch of matches, they're going to play it all and just suffer for the rest of the week. Um, but these ligaments do become very, very, can get irritated in a big way. But let's go over some of the anatomy. Between the radius and the ulna, the thing called the interosseous membrane, and it's a ligament that connects the two bones. So it kind of anchors the radius and the ulna together, which is pretty important. There's another ligament called the oblique cord. This runs between the radius and the ulna, again anchoring it, but allowing for certain motion. Okay. All right. Here's another big one we got to be aware of: is the annular ligament. This encircles the head of the radius and meets the radial collateral ligament in the outer side of the elbow. It allows for flexion. So the ligaments in the elbow allow for these really dynamic moves that we see with our hands. I mean, your hands, if you put your palm up, you turn it sideways, you turn it clockwise, upside down, pull your wrist. All this is a lot of this stuff is originating at the elbow. So it's very important that all these things work properly. Um, so basically, the ligaments of the elbow, strengthen the joint and hold the bones in place and allow for movement that we're not typically going to see. All right, so let's try to figure out why is the elbow such a wonderful joint. Let's talk about that. Well, the elbow really performs two movements, and they're really, really important movements. Um, Bending and strengthening. As you strengthen the arm, so your structure is really, really stable, and that what I mentioned before about that medial collateral ligament. that really helps stabilize the joint. Okay, it just keeps that joint locked into place when you do the extension. So it's really really important because the two things you have flexion is when you bend, and to achieve a contraction of the powerful muscles in the front of the upper arm and the biceps and the brachialis. And extension is the contraction of the triceps muscle in the back of the arm. So all these things take place in the upper arm, translate through to this mechanical wonder of the elbow. So when you have tennis elbow and you repeatedly strain that joint, not only going to get ligamentous damage, as we mentioned earlier, the thing possibly called a avulsion fracture, where the ligament is attached into the bone actually comes out of the bone, but you also can cause scar tissue. And scar tissue, the muscles of the elbow aren't really that, there's not a lot of muscles, if you think about it. So what happens is these muscles, the covering, we call it fascia, and the fascial covering is very nerve rich. And the nerve rich fascia, it gets irritated. I want you to just imagine you take a pound of hamburger meat, put it into a Ziploc bag. Then you take a pound of hamburger meat and you put it into a bubble wrap. Well, the bubble wrap is what the tissue, the fascia, becomes like when you have repetitive sprain strains. So on the surface of the fascia, which is a very thin membrane, you get adhesions. And adhesions are basically a form of scar tissue. So adhesions will buttress up the fascia to take tension off of it, but in the end, it restricts the motion. So every time you play aggressively, or you do again as a carpenter do excessive motions with the forearm, you're going to aggravate it, and that's where the pain comes in. So typically, the best way we have found to really work around that is to work with some soft tissue techniques. Cupping is a very good technique. It draws the tissue, the fluid out of the tissue in a very, very effective way. And that cupping is something that got started in ancient Chinese medicine. It's been around forever and very effective. And you see athletes using it today. Why? Because it works. So the cupping is one of the methods we use for everyone coming in here with tennis elbow or golfer's elbow, medial epicondylytis. So the cupping will draw the tissue out, as opposed to a massage, which will try to release the tissue, pushing it inward. It's a reverse motion, and that helps get like a lot of times, even these small muscles of the forearm, you're gonna have you're gonna have issues where the lactic acid pools and the muscles become dysfunctional. So you want that tissue to release it, and that pressure from outside on the cups create on the surface of the skin will draw the tissue out and make it a better environment to heal the soft tissue component of the tennis elbow. Now, another thing we use is Groston. Groston, I would say, is going to address more of the adhesions that form in the fascia plane I just discussed moments ago. The fascia is the covering on the muscle. Remember that Ziploc bag or the bubble wrap bag? Well, think of the bubble wrap as scar tissue, and what Groston does, or Groston again is something that got Shui Gong or something like that was called in ancient Chinese medicine. But what it does is it's an external technique that debrides the fascia, and so it breaks up those adhesions, and it's a little uncomfortable to the point where it could actually be painful, but very effective at removing those things. And then we'll mobilize the joint to make sure everything's working properly. In addition to that, we're going to throw some laser into it to let the tissue heal faster. So light energy, just like photosynthesis, will heal. So we're pretty keen to use laser as well to heal it. And there are some certain exercises, and breaking again is very effective, but you're only putting off the inevitable if you're really going to be aggressive with the arm. So let's just do a quick review. One, tennis elbow, highly treatable. Advil's going to get you comfortable afterwards. It's not going to fix your tennis elbow, especially if you're a high level type A personality. Got to play and play hard. It's just not going to do that. So what we do here is cupping to get the lactic acid out of there. We do Groston, or another term they apply for Groston these days is IASTM, instrument assisted soft tissue manipulation, to remove the adhesions. Debride those adhesions that form the fascial plane. Next thing we're going to do is we're going to do some laser. Very, very important. Laser, again, like photosynthesis, helps to have the tissue regrow a lot faster. It fires up these tiny cells, these tiny organelles, which are inside a cell that produce energy. So mitochondria, think of it as the powerhouse of a cell. Mitochondria produce ATP, adenosine triphosphate, to fuel the cell, and you get more production of that when you have more light. And laser light, just like photosynthesis, induces that type of cellular growth. And again, joint mobilization, put that joint where it needs to be, give you some home exercises, braces to apply, and basically get on with your life. But tennis elbow can be treated. We also treat plantar fasciitis. It's a whole nother topic, but very similar in our approach to taking care of these soft tissue injuries. Now, people say, as a chiropractor, why would you treat soft tissue? Well, because we do, and a lot of people aren't trained in how to really relieve tennis elbow or plantar fasciitis. And we do have a PT on staff. He works with us too. So it's a joint approach to get people's elbows working properly and get back on track as far as it relates to tennis and doing the things you love. Listen, I'm Dr. Brian McKay. I wish you a happy July 4th. I've got a few patients coming in this morning who are in rough shape, and I'm bagging it. All right, listen, have a great day, and happy 4th of July. Happy birthday, America. All right, take care.